Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hey, what's up, fam? Dr. G and Dr. B here with another installment of AMG Vitality Vault. And we're going to focus on vitality today with what the topic is.
We're going to be talking about regenerative therapies. So we're going to be focusing on joints, though.
Joints
Yes.
Attached to your body, right?
Joint inflammation, joint pain. So tell us what sucks.
So, so people who typically have joint pain are really active folks, people who love to go outdoors and hike. So if you're outdoorsy, look at these. These are my hiking socks. There's a picture of I think it's a pine tree right here. On the back, there's a bear running from a bear. That's outdoorsy.
Yeah.
So this one is geared towards my weekend warriors, or honestly, people who just are suffering with joint issues and they want help. And these are modalities that we have used in our practice and we have used on ourselves personally to feel better as we progress through life. So what is regenerative sports medicine?
Basically, medical therapeutics that are geared towards healing damaged tissues, injured tissues, and these from injuries or from overtraining or just from, getting older, arthritis setting in. Getting what we call degenerative joints. So any kind of inflammation that sets in the joints, then these are therapeutics that are used to help to reduce inflammation, promote healing. And regenerative therapeutics typically helps your body to heal itself.
Yeah. So basically, we're looking at modalities that go in and allow your body's natural healing to be amplified. Because guess what? If inflammation stays for too long, the body's ability to bounce back dips significantly. So we employ these therapeutics to help people live much better and get back to life a lot faster. Athletes, commonly, right? Active individuals, people who overtrain or not overtrain, but just work out, and honestly, people with just daily life issues of joint pain. This is people who can definitely benefit from the actual treatments that we do.
All right. So here are some therapies that are used when we're talking about regenerative therapies. So PRP or PRF, a lot of people have heard about this, the platelet-rich plasma or fibrin. This is basically extracted from your own blood. So it's nothing foreign that you're using in your body. We spin it down in a tube, extract the platelet-rich fibrin or the matrix, and inject it back into different areas. It could be injected straight into joints, into tendons, into muscle areas of damage, and it helps with recovery. Platelets are healing, and it helps to bring in other healing factors into the area, helps to promote your body's natural production of stem cells in that area, so it aids in healing.
And the good thing is when you use PRP and PRF in particular, which we kind of are more fond of, think of PRF like a fishnet. It's a meshwork because it's the fibrin matrix, right? So you have that fishnet, and then we typically add in other regenerative therapeutics along with that meshwork, like whether it be cellular-based therapies like mesenchymal stem cells or even using exosomes, those are mixed in, and the mesh kind of holds them together and keeps them in the area a little bit longer so they can do their good work.
And releases all those good factors.
Segueing to cellular-based therapies. So there are different ways of thinking about this. So if you go online, it's called stem cell therapy and whatnot, which is kind of a layperson term. But what we know it as is cellular-based therapies, because what it is the use of mesenchymal stem cells and exosomes. Exosomes are literally the small packets created by the stem cells, which have all the microRNA and healing factors and good cytokines and chemokines and interleukins in them, and growth factors too, to help with healing and reduction of inflammation in the tissues of concern that they're placed in. Now, typically stem cell procedures used to be, and they still do it actually, where they do bone marrow aspirate. That's a procedure that you do with some doctors. You can even do adipose tissue, which is fat tissue. So there are different ways of getting these cellular-based therapies. The more common way would be more through donors, because the cellular-based therapies through donors, or the stem cells through donors, they actually have they're antigen free. They're not going to give a reaction because of how they're harvested and what kinds of cells they are. They're blank cells. They haven't differentiated yet, so that's why we use them in certain procedures.
All right. And I know we'll be talking more about this one, stem wave, shockwave therapy. We have a whole slide on that one. That's Dr. Morris's baby.
Love me some shockwave.
And this is basically a therapy that uses sound wave to help, just targeted sound waves to stimulate blood flow, improve, decrease inflammation, improve tissue healing. So we'll talk more about that in just a minute.
Yes.
Peptide therapy. I know that we have another podcast that will be going a little bit more into peptide therapy, but these are kind of neurotherapeutics that are aimed towards decreasing inflammation, increasing healing, and overall wellness, actually. We have a couple up here. We talked about, we have BPC 157, which is, how many amino acids
It's
in
a
that
15
one?
amino acid chain. It's basically... It's a signaling molecule that's a synthetic version of a peptide that naturally occurs in your gastric juices in your gut. And this is a really good one. It's kind of foundational for us in our practice. It's the basis of helping healing. I mean, I have used BPC, and Dr. B has used BPC in ourselves for healing, as well as in a few clients who are even going in for surgical procedures to help them heal up faster. So we typically use these cellular-based or these regenerative therapies just to give patients an edge and to have the healing be a lot faster to get them back to life. Because you don't want to wait the 4 to 6 weeks. Life happens. If there's a way, and I firmly believe that if there's a way to help the body get to where it's going faster, why not use that to heal? Why not, right? Absolutely. So peptides are huge in our practice. I love them. I mean, I'm never going to stop peptides. I'm sorry, not going to do it.
Peptide
They're awesome.
junkie.
I am a peptide junkie. The last one here is prolotherapy, Dr. B. Now, we don't do prolotherapy in our practice, but we know some doctors who do. What exactly is prolotherapy?
So it's an injection therapy that is, the solution is usually a sugar-based solution.
Okay.
Typically dextrose is used.
So not Kool-Aid. It's not Kool-Aid.
And no, not that kind of sugar.
Not regular Coke, no. Okay.
No,
all right,
no.
fine.
Wow.
You said sugar-based, so it's not high C? No? Oh, man.
But anyways, let's get back to prolotherapy. It's usually injected into a joint, a tendon, or muscle areas of inflammation.
Yes.
Again, it's one of those therapies that aim to decrease inflammation. You could see a general trend of everything that, we're talking about here, decrease in inflammation and allowing the body to be able to heal itself.
So what I gather, so basically using the prolotherapy, you're creating almost like a micro trauma in the area to kind of restart that healing journey again in a joint that's chronically inflamed.
Correct.
So, okay, cool.
Yes.
Yeah, nice.
Yes,
Nice.
absolutely. All right. So here was what we were talking about, the stem wave.
I know that guy. I know that
Dr.
guy.
T right here. The
Yes.
stem wave is his baby. Again, targeted shockwave therapy. So tell us more about that.
So stem wave is basically shockwave therapy, like you said. So it's sound. It's not electricity. And what we know is, and there's a lot of papers out there just showing the benefits of it. When we use this targeted shockwave therapy on joints or tissues that have been damaged, what happens is a few things. One, we increase blood flow in the area, which is good because more healing factors come in. Two, there's a mechanotransduction. What that is, it's a fancy way of saying when the sound wave hits those cells that are in the tissue of concern, it pretty much is like if you had a beach ball in your hand, or a balloon, sorry, and you bounce the balloon without popping it, it shocks the cell, like almost like a shock to the system cell, and allows the cell to think, holy crap, we just got hurt again. And then the cell kind of goes back officially into the healing phase, where it calls upon, other growth factors around to come and help heal the area. It's pretty cool technology. You're activating healing in areas that have been damaged. And you can see with that chemical reaction happening in the area, your natural stem cells begin to migrate towards that area because they're like, hey, what's going on over there? Mm-hmm. And then they begin to help to heal. So this is kind of one of those where you wanna definitely experience the shockwave therapy, and we do it at our practice, and it's been a game changer. I use it myself in my things we talk about, we use ourselves.
Absolutely.
So I've actually had stem cell injection in my knee, right? And I did great for like 18 months. Then Dr. B forced me to go to the gym, forced me to do box jumps, and I undid the good work. So I had to end up doing the shockwave therapy.
Funny, I wasn't there that time.
Really?
Yeah.
Are you sure? I could have sworn you pushed me. But these are things that we use on ourselves before we even decide to have patients give it a try. And it's been a game changer in my practice for those who have been dealing with chronic health issues or chronic joint issues. So shockwave therapy is something you should definitely consider if you're someone dealing with chronic knee pain or even osteoarthritis, end stage, or you're staring down the barrel of the gun of surgery and you want something else to kind of stave off or kind of postpone for a little while the surgery. It might be an option for you to seek a session or try out the shockwave therapy for yourself.
And who can benefit? Well, anyone actually.
Anyone.
Whether you're an avid athlete or you had an injury, meniscal injury, something, you're recovering from that, or you had surgery for some reason, recovering from that surgery. Anyone who's pretty active as well benefit, because most people who are active do end up with some kind of chronic joint pain, whether it be a knee, a hip, a wrist, and some of these things are named after the sport. We have golfer's elbow, we have tennis elbow,
jumper's knee.
Have jumper's knee. So yes, it's great to be active, but sometimes that can be a little bit hard on the joints, and this can help you.
And these modalities are more based on the adult side, just because, the anatomy of a child or kids who are going through puberty, their body is changing rapidly. So if you're someone who's under the age of 18, always discuss with your medical provider to see if any of these things would help you. But I'll tell you, by and large, we tend not to, just because, kids are more resilient, one. And two, we just don't have enough data on pediatric subjects. And we do not want to mess with pediatrics. Growth plates are huge. You don't want to mess with growth plates.
Like that, yeah.
You want to, just allow kids to heal naturally, because let's face it, they bounce back faster than we do. So
that was regenerative therapies.
I think,
for joint care.
It was a good one.
Yeah.
If any of these modalities, really piqued your interest, send us a message. Email us.
Absolutely.
amgvitalityvault@gmail.com. We would love to go deeper into what we do, and check us out. See if we can help you, get your joints feeling better, or just getting that longevity game up.
And Dr. G is definitely an expert in the stem wave technology.
Love that.
Yes, he's even one of the company's clinical
advisors. Mm-hmm.
So any questions about that, just drop us a line. And we'll get back to you.
Happy to help you guys feel better.
All right, guys. See you next time.
Take care.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.